Thank you. Molecular U is leading the predictive health revolution, and we're doing that with a proprietary molecular testing and analytics platform that we spent years developing. Our problem is big. Right now, 80% of all expense happens with 20% of the population, and the system only picks up disease when it's super apparent and it's really expensive. And yet, a lot of conditions start many years in advance. If you see the woman on the left side of the screen, her name is Diane Balin. And she's proof that early detection of molecular changes can save lives. So pancreatic cancer is generally known as the death sentence. And yet she was a regular subscriber of ours beginning in 2018. And you can see our test, which shows a heat map of all her biological functions around metabolomics and proteomics, was clear. But through the years, her signals turned red. And by 2022, she had a 5-alarm fire. We sent this to our doctor. He prescribed imaging, and they found 3 tiny little lesions on her pancreas. It was so early, she was eligible for surgery, which is super rare. And we ran her tests the following year. You can see she reverted back to normal. The future is multi-omics-driven predictive medicine. We have 3 problems to overcome, though. So first of all, finding the biomarkers. There are over 1 million new validated pieces of clinical and scientific research per year that's beyond human capability to find. We have specialized large language model tools that we use to bubble up the promising biomarkers. The second thing we overcome is our proprietary mass spec assay will take these markers and we'll see if we can validate the research. And if we can reproduce the results, then it makes it into the starting lineup. Lastly, this is a huge mass of really deep data. And if it's not easy and accessible to both patients and doctors, it's not going to make it into clinical practice. We make it easy, accessible, and reimbursable. We do this by generating risk scores in over 26 health areas. You can see them from left to right. We have inflammatory, different types of cancer, metabolic health, reproductive, cardiovascular, kidney disease, and we're especially good at cognition. In fact, we have average predictive risk scores of 95% for cognition, and for Alzheimer's, 97%. We also run it with one single tube of blood, which picks up all the comorbidities and makes the doctor's life pretty easy. Our total addressable market that we're starting with is neurology and longevity channels. And the signed partnerships are on the left. HealthQuest is our CLIA lab. We just signed them last week. They were going to be our main lab of record for running our test results. They also bring 500,000 patients to the table. Dent Group's the largest neurological clinic in the US, and they head up NeuroNet, which is an additional 72 clinics. Gray Matters is a Medicare-based chain out of Florida specializing in dementia, and Well Health is longevity and health and wellness. Between them, they have 1.3 million patient footprints. Additionally, we have huge demand. 3.6 million patients through a variety of channels have approached us. We can earn about $650 per test of gross revenue. We crossed over into 2 really key growing markets. So first of all, on the multi-omics testing and analytics side, we're the only ones who've been able to successfully take proteomes and metabolomes and integrate them for one dashboard. We also, those companies you see are very successful, but they're only addressing pharmaceutical companies. We're applying this to the healthcare and insurance situation of value-based care. We have a uniquely qualified team, over 250 years of health experience, 1,000 peer-reviewed journals, papers, and our scientists, David Wishart and Christoph Borchers, are the world authorities in metabolomics and proteomics. Near-term projections, as soon as HealthQuest is implemented next quarter, towards the end, we will begin generating revenue from our signed contracts, and we look to be at $16 million run rate by the close of next year. We have a safe financing. Historically, we've had 15 million in. We were currently raising 8.5. We have 5.6 of commitment, 2.9 line of sight remaining. And we're using this to fund the implementation of HealthQuest, to activate existing customers and continue our channel development. Oops. And I'll see you in the breakout room.